back to Wellness Wednesday on All Sides. I'm your host, Ann Fisher. Everybody, especially children, need sleep. But like adults, children can be prone to snoring and breathing through the mouth during sleep, possible signs of a more serious problem known as sleep-disordered breathing. Dentists are starting to play a role in treating those disorders. Joining us is Dr. Michael Firouzian. He specializes in sleep apnea, children's orthodontics, and is a member of the American Academy of Dentists. And Dr. Firouzian, welcome to the show.
Thank you very much. Thanks for having me.
Why is this role for dentists and not pediatricians?
Sleep-disordered breathing is a very general term given to sleep disorders that affect breathing. And as dentists, we are very much involved in breathing as the mouth develops, and proper tongue posture and proper nasal breathing. So we are at the forefront, I believe, and we see our patients quite frequently, and I think we can address and identify issues with their sleeping patterns and certain signs and symptoms that we look for dentally.
Is this something that you work with in tandem with a pediatrician or what?
We try to work as a team. Yes, anytime I have a patient who I suspect of some type of sleep disorder breathing, I get in touch with their pediatrician and get them involved and ask some questions, perhaps even find out about a referral to an ear, nose, throat doctor to have their tonsils and adenoids checked. Although we do that as part of our dental exam, as a routine part of our dental exam, but if it needs further evaluation, that would be the time to speak with a pediatrician.
What are some of the red flags for you as a dentist that pop up that suggest there might be an issue?
The main thing I look for is tongue posture. When it comes to breathing, the role of the tongue, I think, has been way underestimated. And in recent years, it's become more and more known that the tongue plays a huge role in proper breathing, as well as the ability to breathe normally through your nose. Mouth breathing is not really the proper way to breathe, and the tongue plays a huge role in that. So as I examine a child, I'm looking for where they're positioning their tongue, what does their jaw development look like for their age? Are they developing normally? Do they have a very high palate? That's usually an indication that the tongue posture is not correct. Normally the tongue should be resting up against the palate that develops the maxillary or the upper arch, which also affects the development of the nasal cavity. And the floor of the nasal cavity is basically the roof of the mouth. So those are things I look for. Dark circles under the eyes.
Which shows that you're just not getting enough sleep?
Exactly. And then I start asking some questions from the parent. Is the child fidgety? Do they have concentration issues? Are they disruptive? So there are a host of signs and symptoms that we look at.
And you said this sleep disordered breathing can pop up with a lot of different symptoms, like tiredness, distraction, fidgetiness, maybe being diagnosed as ADHD.
Absolutely, that's actually one of the symptoms. Kids behave very differently due to lack of sleep versus adults. Kids become hyperactive and they get very fidgety, whereas adults usually get more tired and more lethargic. So that's definitely one of the things that we ask about.
When I was reading the materials to prepare for this show, there was an illustration of just photographs of a child at the age of 10, 14, and 16 or something, and it showed how he developed and how sleep-disordered breathing affected actually what he looked like. So what comes first, the chicken or the egg? I mean, is it something physical that's causing the disorder, or does the disorder cause physical changes?
That's a great question, and I think it does go both ways. I think if we go back to the child's development, it really starts at birth. There is a huge difference between breastfeeding and bottle feeding. The breastfeeding process actually starts to develop the tongue posture that's so important for the development of the jawbone.
Healthy development, right?
Mm-hmm. Right. Bottle feeding is very different. The action of the tongue is totally different between bottle feeding and breastfeeding. So from that point forward, the whole cascading effect can begin. And as the child becomes more and more dependent on bottle milk, the tongue posture starts to change, so the development of the jaws begins to be affected. Not only that, there's a huge problem with milk allergies in children. Cow's milk is really not designed for growing babies. So they start to develop allergies, which causes nasal blockage. So they become mouth breathers from a very, very early age. And this just continues throughout their development and growth.
Is this something that parents can observe in their babies?
Absolutely. We in fact recommend and encourage parents to watch their babies while they're sleeping, and even their young children, to really observe them or record them somehow. See how they're sleeping, especially early in the morning. Are they sleeping with their mouth open? Are they snoring? Are they thrashing around? Can they hear them talking in their sleep? There's a lot of things that they can look for, and of course, behavioral issues at home or at school.
You're listening to Wellness Wednesday on All Sides with Ann Fisher. We're talking about sleep disordered breathing in young children, babies on up. My guest is Dr. Michael Firouzian. He's a pediatric dentist and orthodontist at the Center for Family and Cosmetic Dentistry here in Columbus. If you have a question or comment for Dr. Firouzian, give us a call, 614-292-8513, or email us at allsides@wosu.org. Is it possible that it's hereditary? Is there something you could be asking the parents about their own history?
Sure. There's definitely a genetic component to this problem of sleep disordered breathing, because there are certain anatomic features that the child can inherit from a parent or a grandparent. And so that is part of our questionnaire. We ask about any sleep issues with mom or dad, or any concerns that they've had, or past history of mom or dad having issues with sleep themselves. So there's definitely a genetic component.
How common is this?
A recent study found that about 1 to 3% of children between the ages of 5 and 17 have this issue in one form or another. And that same study found that 9 out of 10 children had at least one symptom of sleep disordered breathing. And so I think the problem is much more prevalent than we realize. I think we just need to be looking for the signs and symptoms.
When should parents have their child looked at by a medical professional, just with even just one symptom, or what do you recommend?
I would say by age 2, they really need to be looking at how the child is sleeping, how they're breathing, how they're swallowing, and as they begin to speak. Speech is a big factor as well. Speech development, pronunciation of certain words and certain vowels and sounds are more difficult for children with breathing problems. So as early as age 2 would be a good time to begin to really look at them closely.
Now, dentists can't diagnose sleep disordered breathing, right?
Correct. However, we can screen for it. So when I see a child that I suspect could have issues with sleep, I ask the right questions, both from the child and the parent, depending on how old the child is. And if it leads me to believe that they do have an issue, then that's the time to contact the pediatrician and perhaps try to get a sleep study performed on them. Like
they do with adults, where they put the monitors
Yes.
all over your head?
Correct. For children, it's a little bit different, but pretty much the same process. The parent usually is allowed to be in the room with the child, depending on how old they are. But yes, it's pretty much the same process. They are attached to a medical monitor, to a sleep monitor, where their sleep is closely monitored throughout the night.
Vito in Columbus, you're on the air with Dr. Michael Firouzian. Hi, Vito.
Yes, how are you today? Thanks for the chat. My question is that I have a 4-year-old boy, and he grounds his teeth sometimes when he sleeps, and I just is this a concern for parents to pay attention for this thing?
So he has a paroxysm, yeah.
That's a great question. Yes, actually, that is one of the telltale signs of sleep and breathing issues, if the child is grinding their teeth or if there's a lot of wear on their primary or baby teeth. And it is a result of the attempt to open up the airway. So they're clenching their teeth to try to create a little bit better airway and airflow. So that I would definitely have them looked at, have the tonsils and adenoids looked at to see if they're causing an issue, and have the dentist look at the teeth as well.
Vito, thanks a lot for that call. Why would it affect some children and not others? Are there some children who sleep with their mouth open or breathe through their mouth and during sleep that don't develop a lot of these symptoms?
I think, as with any condition, some people, including children, are more prone to it, more susceptible to it. The host of symptoms and the list of symptoms is so large that it just depends on what the weakest link is in that chain. Some kids will grind their teeth and they don't have many of the other symptoms, and some will have for example, the bedwetting or the night sweats or sleepwalking, and we don't see much in the way of bruxism or tooth wear.
What does bedwetting have to do with the sleep disorder?
It's believed it has to do with the endocrine system. I'm not completely familiar with the mechanism, but it has to do with the hormones and the changes in the hormone balance of the body that causes both bedwetting as well as night sweats.
How big of a deal is this getting to be? Because when I was growing up, it was just nothing. I mean, you never heard anything about any of this stuff as far as children were going, or 20 years ago when I had my own child.
Well, I think as we have become more aware of sleep disorders in general, both adults and children, it's become more and more apparent. I think the problem has been there probably for a long time. We just didn't know what to look for. And now we're much more aware. And I think, as speaking for myself as a dentist, I can definitely see certain patterns because I treat older adults for sleep apnea as well as jaw problems. I see the trend, how it's developing in younger kids. And I'm very fortunate to be able to recognize it early on and try to address it as quickly as possible.
Is sleep disordered breathing the same thing as sleep apnea?
Sleep disordered breathing is a general term. It's a broader term.
Okay.
Under sleep disordered breathing, then we have three if you would, severities. So primary snoring is the first one. The next one is called upper airway resistance syndrome. So that's sort of the middle of the road as far as severity. And then obstructive sleep apnea is the third one. And it's the most serious. That's where the breathing can actually be completely halted during sleep.
And how does a dentist treat for sleep disorders like this?
For children, we typically will try to, if the adenoids and the tonsils are the main issue, we try to get those out. And the next step would be to look at the development of the jaw bones. If they have a very narrow arch, let's get them into expanders and try to widen the arches, because that will open up their nasal passage.
Okay.
And then try to get them into a correct tongue posture and promote nasal breathing. Really, that should be the goal ultimately, is to correct tongue posture and turn them from mouth breathers to nasal breathers.
How do you change tongue posture, particularly in a child?
Well, luckily, there are certain appliances that we can use that promote that. HealthyStart is one that I use that's been very successful, and it's been around a long time. And the child will sleep with this appliance, and it literally will help them position their tongue up on the roof of their mouth. It's designed so that it restricts tongue movement to the roof of the mouth,
which is where it's supposed to be?
Which is where it's supposed to be. And it also helps to bring their lower jaw forward, and more importantly, keeps their mouth closed. Because every time the child opens their mouth, the airway actually closes down more. So if the mouth is open, the airway tends to collapse more. So anything we can do to hold that jaw forward, keep the mouth closed, and keep the tongue posture where it should be is very helpful.
Well, Dr. Michael Firouzian, thanks for joining us to talk about it.
Thank you so much for having me.
It's Dr. Michael Firouzian,